Good evening, DJ. My name is Ida, and I'm a nurse practitioner student at United States University. Today, I am assigned to do your musculoskeletal assessment. But before we start, I would like to ask permission if it's okay that we are going to videotape the examination and post it in YouTube so my instructor will be able to review the process.
I give you permission.
Thank you. So before we start, would you mind stating your full name and your date of birth?
Dylan Joy Bernard, and my date of birth is July 7th, 1997.
Okay, so the first assessment we're going to do is the upper, let's do the upper extremities. So I'm going to inspect your fingers. So I'm going to inspect for any swelling, any redness, any deformity, any presence of nodules. I'm going to check for joint for joint symmetry, and as well as presence of atrophy. Then I'm going to palpate the distal and the proximal interphalanges, as well as the metacophalangeum. And next is I'm going to ask you to do the range of motion, if you can make a fist, and then do the range of motion of flexion of the fingers, flexion and extension. Okay, flexion and extension of the fingers. Next is another range of motion would be abduction, which is moving away from the body, and then adduction. So that would be for the fingers. Next is I'm going to inspect the wrist. So again, inspect for redness, any swelling, any nodule, any deformity, and also inflammation. Then I'm going to palpate for the metacarpal and the carpal bones of the wrist, and then going to do the range of motion of the wrist. So just like the fingers, we have flexion and extension. Then we have abduction and adduction going towards the body. And then with the wrist, I'm going to do two special tests. First one is the Tinel's test, which is with your wrist hyperextended. I'm going to palpate, just relax, palpate the medial nerve, and if there is any pain radiating to the palm and the second, the third, and the fourth finger, that is indicative of positive carpal tunnel. The next one is the Phalen's test. So with the Phalen's test, if you can put your wrist 90 degrees, so either praying or the opposite direction where your fingers are pointing downwards, for 40 to 60 seconds that the wrist is in this position. Any pain or any paresthesias, tingling sensation, numbness on the medial nerve distribution is indicative also of positive carpal tunnel. Okay, next is the elbow. So again, I'm going to inspect the elbow for any swelling, any redness, any nodules, any deformity, and then I'm going to palpate the external ulnar surface, and then palpate the olecranon process, and then palpate the medial epicondyle, and then the lateral epicondyle. So during palpation, this is where also we identify what we call as the tennis elbow and the golfer's or the baseball elbow. So with the tennis elbow, there is pain on the outer side of the elbow, and then for the golfers or the baseball, it is the inner side of the elbow that will have the pain during the repetitive movement. Next is the range of motion for the elbow. So we have flexion and extension. And then with the palm pointing upward, this is supination and then pronation. So supination and pronation. So next is we have the shoulder. So shoulder will be inspected again for any deformity, any swelling, any redness, any nodules, any check for joint symmetry, and then palpation. So with palpation, I'm going to start with the acromioclavicular joint, and then I'm going to palpate for the bicep fossa and also the crocoid process, and also the humeral tubercle. So we have to palpate for presence of tenderness and presence of fluids. Next is range of motion of the shoulder. So the range of motion of the shoulder would be, stand. So we have flexion and extension, all right, and then abduction, which is away from the body, and adduction. And also we have so abduction and adduction, and then we have internal rotation, touching just the small of your back there, and then when you touch the back of your neck, that is an external rotation. So one test with the shoulder to check for rotator cuff is what we call the internal rotation lug test. So with that, with like in this position, so have to do touch the dorsum of your palm, and then I'm going to push it away from your back, and that is one of the testing to check for rotator cuff injury. So next one is we are going to check for the head and neck. So for the head and neck, there should be an inspection for deformity and also posture. And then I'm going to palpate for the TMJ. So with my two fingers, I'm going to palpate just in front of the tragus part of the ear. And then I'm going to request you if you can open and close your mouth. Okay. So then I'm going to palpate the sternocleidomastoid muscles, the cervical spine, the paracervical muscles, the trapezius muscles, and the rhabdoids. And then after palpation of the head and the neck, I'm going to ask you to do the range of motion of the neck. We have flexion, going flexion towards the chin to the chest, and then extension, and then you do side to side, okay, and then bend towards your ear. Okay, so that would be for the neck. And then there is a special testing for the cervical compression test, which is called the Sperling test. So with the Sperling test, we can have the head flex on one side, and then I'm going to put pressure, and that's why it's called cervical compression, but I'm not gonna do it heavy, but this is how you're going to test it. And if there is aggravation of the symptoms, that is considered positive. Next is we are going to do the lower extremities. Okay, so if you can sit for a minute, and I'm going to inspect first your toes and your feet. So again, inspection of the toes for redness, any deformity, any swelling, any nodules. And this is the time also that we check for presence of plantar warts, the corns, the calluses, and also we have to check for joint symmetry. Then inspection of presence of the flat feet. So this is best identified when the patient is standing. where the arch of the foot is done. Next is we have palpation of the distal and the proximal phalanges, the interphalanges, and then also the metatarsal palpation of that. Next is palpation of the interdigital neuroma. So this is part of the palpation, and then also palpation of the plantar fasciitis. So palpation of the plantar of the foot with presence of the pain could be indicative of plantar fasciitis. Next is the range of motion of the feet. So that would be flexion, just curl the toes, okay, and extension of the toes. It's just the toes, okay, and then inversion, pointing inwards, and eversion is pointing upwards. Next is the ankles. So with the ankles, I'm going to inspect for any deformity, any swelling, and the ankles basically we have to inspect for any discoloration. Next is palpation. So I'm going to palpate the Achilles, also the medial malleolus, and also the gastrocnemius. And then for the ankles, or for the ankle, the range of motion would be dorsiflexion, pointing forward, and then plantar flexion. So that would be with the ankles. Next is checking for the knee. So first is inspection of the knee. Again, inspecting for any deformities, redness, any swelling, any nodules, and joint symmetry. And palpation is to palpate on the suprapatellar notch, and then palpate on the side of the patella, and with both cuff hands palpate on the popliteal fossa for Baker's cyst. Then the range of motion of the knee. So if you can stand, the range of motion of the knee includes flexion and just extension, okay, flexion and then extension. And then there are several tests, special tests for the knee. So if you can lay down in a supine position. So I'm going to check for before I go to the special test for the knee. Also during inspection, I should be able to check for any valgus and varus knee, which means knock knee and bow-legged. So anyway, going back to the special testing, so we have the valgus stress test and the varus stress test. This is to test the medial collateral ligament. So for the valgus stress test, so I'm going to bend your knee like a 20-degree angle. I have to hold your lower leg just above the ankle, and then I'm going to hold your lower thigh just above your knee with my other hand, and then abduct. So abduct the knee, that would be the valgus. The varus is the opposite, which is adduct. Okay, and then another test is what we call the Lachman's test, and this is to check the anterior and the posterior cruciate ligament. So with that testing, I'm going to flex the knee again, just kind of a 20-degree angle, and then I'm going to hold part of the leg here, and then I'm going to push the tibia anteriorly and posteriorly to check the laxity of the crucial muscle, cruciate ligament. So then another one is the Drower's test. So with the Drower's test, I'm going to bend your knee on a 90-degree angle, and then I'm going to sit on it so it stabilizes the position, and with my both hands, again, I'm going to push the tibia anteriorly and posteriorly to be able to check for the laxity of the cruciate ligament. So between the two, they said that the Lachman's test is more accurate than the Drower's test. Another test is what we call the McMorris test. This is where we check for meniscus injury. So with the knees being flexed and then laterally rotated, I'm going to straighten or extend the lower leg while I'm doing the lateral rotation of the knee, and that will check for meniscus injury. So that would be for the special testing for the knee. Next is I'm going to check the hips. So with the hips, if you can stand up again, so I'm going to inspect for alignment, symmetry, any presence of deformity, and then I'm going to palpate for the sacroiliac, the anterior sacroiliac joint. So with that, I'm going to identify first the iliac crest and then palpate towards the front to find the anterior sacroiliac joint, and then I have to palpate for the I'm going to palpate for the great trochanter here, and then palpate again for the superior sacroiliac joint, and also palpate for the sacroiliac joint, which is just below your spine, and then just above the buttocks. Then going to do the range of motion of the hip. So with the range of motion of the hip, so we have the external rotation, okay, and the internal rotation, and then the flexion of the hip, and then extension, and then we have the abduction, and then the adduction. So this is for the active range of motion. But for the passive range of motion, if you can just lay down. So again, for the flexion, so I'm going to flex the hip and then extension. All right, for the abduction and then the adduction, and then the external rotation of the hip and the internal rotation of the hip. So those are the passive range of motion. Next is we're going to do the two special tests. One is called the Thomas test. This is where to check for the hip flexion contracture. So the Thomas test is I'm going to flex the knee, and while I'm doing this, if it's positive, the leg that is extended will also get elevated. And the other test is called the Patrick's or the Faber's test, which the hip is flexed, abducted, and externally rotated. So with the Faber's test, I'm going to position that, and then I'm going to push the knee downwards. And if there's any pain on the back or on the posterior hip, there's an indication that further testing, or we need to check for any problems. That would be for the hips. Next is the spine. Okay, for the spine, while she is standing sideways, I will be on the side checking for the cervical spine, checking for the presence of lumbar lordosis and the dorsal kyphosis. And while I'm in the back, I have to inspect for the symmetry of the shoulder, symmetry of the iliac crest, and also the gluteal fold. And I will palpate for the sternocleidomastoid muscles, for the cervical spine, the paracervical muscles, the trapezius, and the rhabdoids. Then I'm going to let you bend. Okay, so while bending, should be 90-degree angle, like while you're touching your toes. I'm going to check for the presence of scoliosis, again for the symmetry of the shoulders and the hip and iliac crest. And also, you can straighten up now. And then I'm going to palpate the supraspinal process. And then percuss with my ulna. So this is to determine if there's any compression fracture of the spine. Then the range of motion of the spine, she did perform the bending forward. Now you do bend backwards, and then bend on the sideways, and then twist your shoulder. So that concludes our musculoskeletal system examination. Okay, thank you.